So let's talk a bit about Patrcia Benner. So Patrcia Benner is a well-known international thinker and researcher on health, stress and coping, skill acquisitions and ethics. So a bit about her early life. Dr. Benner was born in Hampton, Virginia in 1942. She graduated from Pasadena College in 1964 with a bachelor's degree in nursing. Patricia Benner also completed her master's degree at University of California in Berkeley with medical and surgical nursing. So she also became an associate professor in the Department of Physiological Nursing at the University of California, San Francisco after receiving her PhD in 1982. So Patricia Benner has came out with 10 books, but I've only listed 4, which she is the author of From Novice to Expert, The Primary of Caring, The Crisis of Care and Caregiving. Did you know that Patricia Benner is also nominated of the Living Legend of the American Academy of Nursing in 2011? So next will be the educational background for Patricia Benner.
The next part will be for the educational background. Patrcia Benner started college at Pasadena City College, where she received her bachelor's degree in nursing in 1964. She obtained her master's degree in the University of California, Berkeley in medical surgical nursing and PhD at the same university. This is some of the list for the work experience of Dr. Patrcia Benner throughout her life. The work experience of Dr. Patrcia Benner started upon accomplishment of her doctorate in 1982. She became an associate professor at the University of California, San Francisco in the departments of physiological nursing. She also became a head nurse of the coronary care unit at the Kansas City General Hospital and an intensive care staff nurse at the Stanford University Hospital and Medical Center. Besides, she also held positions as a research associate at the University of California at San Francisco, the School of Nursing. Throughout her life, she has achieved many milestones that contribute to the nursing theory and nursing world itself. First and foremost, she has published a total of 10 books, which include The Crisis of Care, Expertise in Nursing Care, and the most popular one is From Novice to Expert, which developed into a nursing theory and known as her biggest achievement. As mentioned before, From Novice to Expert theory is the biggest achievement of Dr. Patrcia Benner. This is the theory that our group decided to choose to discuss and share. This theory was first discovered in 1982 by Dr. Patrcia Benner itself. Her theory explained that the nurse develops skills and understand patient's care from an experience over the time through a proper education and from a variety of experience. The theory identifies 5 levels of nursing experience, which include a novice, an advanced beginner, a competent, a proficient, and expert. A novice is a beginner with no experience. They are taught a general rules to have performed tasks, and their rules-governed behavior is limited and inflexible. In other words, they are told what to do and simply follow the instruction, while the advanced beginners shows acceptable performance and has gained a prior experience in actual nursing situations. This helps the nurse to recognize the recurring meaningful competence so that the principles based on those experiences begin to formulate to guide actions. Next, a competent nurse generally has 2 or 3 years experience on the job in the same fields. For example, 2 or 3 years experience in intensive care. This experience may also be similar to a day-to-day situations. A proficient nurse perceives and understands situations as a whole. He or she has more holistic understanding of nursing, which improve the decisions making. These nurses learn from experience on what to expect in certain situations and how to modify plan as needed. Last but not least, an expert nurse does no longer rely on principles, rules, and guidelines to connect the situations and determine the actions. They have a deeper background of experience and intuitive grasp of clinical situations. Their performance are fluid, flexible, and highly proficient. Next, I will transfer this to my colleague for more explanations on this theory.
Now, we are moving on to the nursing meta-paradigm of novice to expert theory and the view of Patrcia Benner in all four meta-paradigms, which includes person, environment, health, and nursing. The person meta-paradigm. According to Patrcia Benner, a person is a self-interpreting being, which means they are not predefined when they are born into this world but becomes defined over the course of their life or experiences. A person also should be non-reflective and have easy understanding of oneself in a particular environment. There are four key parts of an individual must contain, which are: first, the situation significance; second, the body's function; third, the importance of personal issue; and lastly, the importance of temporality. The environment meta-paradigm. Patrcia Benner used the term situation instead of environment because it denotes social setting with social definition and significance. She employed phenomenological words of being situated and situated, which are characterized by the person involvement, interpretation, and comprehension of the circumstance. To be situated implies that one must have past, present, and future, and all of these aspects influence the current situation.
Now let's look into the third nursing meta-paradigm in the nursing theory of meta-paradigm, which is the health. In health, it's all about the person's well-being of mentally, physically, and emotionally. Health is a state of a complete physical, mental, and a social well-being, and not merely the absence of disease or infirmity which defined by World Health Organization. It includes treating and evaluating not only physical but mental and spiritual health too. Evaluating the intervention can indicate the effectiveness and healthiness progress of a patient for a better quality of life. Patricia Benner focused on the lived experience of being healthy and ill. And in her definition, health is something that can be assessed, and well-being is an experience of the wholeness of health. And she also described that health is not only the absence of disease, and health is about the wholeness in the healthy from physical, spiritual, and also mental states. Now we're moving on into the fourth meta-paradigm in the nursing theory, which is the nursing. In nursing meta-paradigm, nurses are the one who must care and understand the condition and physiology of the illness and what patient face to deliver such a holistic care. Values and ethics and professionalism in nursing profession must be maintained and become an innate quality in all nurses. There should not be any negative issues such as a personal bias or any judgmental thinking in delivering care to people who are in need of our service. Patricia Benner stated that nursing must enable a connection and concern in their delivery of care toward the patient. And she also emphasized on the relationship between the experience of the health, illness, and disease in nursing practice. The understanding of the nurses to all those elements will cultivate the empathy and the compassion values in our working. And the understanding can help the patient condition to ease and result in a positive recovery in the patient quality of life. It will also give a positive impact on the nurses, where nurses will always be careful and cautious in fulfilling their responsibilities and work in the right manner.
Application of Benner's theory in clinical settings. Benner's methodology has been applied in nursing field to create novel improvements in how information is gained and developed, the motivation for ongoing education, and how nurses build and enhance abilities based on experience. The 5 levels of skill acquisition can be used to identify and classify the performance and learning needs of staff nurses. The 5 stages of proficiency in novice to expert models are novice, advanced beginner, competent, proficient, and expert. This technique can help discover experts who can teach and guide staff members who are still in the novice to beginner stage. Knowing each nurse's competence level will help the nurse in the educator role be more prepared. Novice stage, which is a student nurse working to acquire nursing knowledge and skills, and for example, still follow guidelines in nursing practice book to do procedures in clinical settings. Advanced beginner stage, newly qualified nurse after past nursing board exam, 6-month experience, first posting after graduated from nursing school, relies on protocol and oversight from colleges. The next one is competence stage, 2 years experience, able to provide independent care to the patient or clients, assume greater responsibility. Advanced beginner stage, newly qualified nurse after past nursing board exam, 6-month experience, first posting after graduated from nursing school, relies on protocol and oversight from colleges.
Next is the proficient stage. In this stage, a nurse must have 3+ years experiences, which she or he able to recognize and respond to the changes of situation in the clinical settings. For example, there is an emergency for the unstable patients. The nurse must know how to respond and react with this situation. Lastly, is the expert stage. An expert nurse must have experience with 5 years in clinical settings. She or he must able in intuitive management of complex cases with patient advocate. This could make the clinical settings more dependent on the nurse, so that nurse can actually make some changes with be more professional in clinical settings. That's all from me. Thank you.